test something called the VOR, the vestibular ocular reflex. Say that 3 times. And basically, there's a mechanism with the inner ear and the eyes, where whenever your head moves in a certain direction, the canals in your ears are stimulated to drive your eyes in the exact opposite direction. And so that's so when we're walking around and looking at things, it's not like looking through a video camera like this. And so it steadies your gaze. And so we're going to do a test called a head shake. Okay? So I want you to look at the tip of my nose. And you can see that when we do a head shake to the left with her, her eyes actually drift off to the left. And when we go to the right, her eyes stay pretty steady, and so we would suspect a left VOR disturbance. So we'll go ahead and do that again. My nose. You can see that real distinctly. You're going to put your legs straight like this. Okay. So we're using the Frenzel lenses here, and this is in order to suppress what's called gaze fixation. So when we're taking her in the different positions, we're able to notice what her eyes do, and this tells us a lot about what's going on with the inner ears and why she might be having some vertigo and dizziness. So I want you to just lay straight back for me, and keep your eyes open and look straight ahead. Yeah, look at that. Look at that. See it?
Mm-hmm.
Yeah. You got dizzy there?
Mm-hmm.
Okay. See a little bit there? We're going to just roll this right into an Epley's maneuver for her. That's going to be real helpful. And of course, I like to use some percussion on this. This helps to enhance the treatment. And really what we're doing here is we're bringing little stones that get into the wrong area of the ear back to a normal place. I'll slowly turn this way. Place in the ear called the vestibule, out of the labyrinthine system into the vestibule.
I thought I might just speed this up for you. Alright, here we go.
You take this right arm and I want you to make like an infinity sign.
What I'm doing here is I'm having her do a figure 8 or an infinity sign with the right arm. During my functional testing, I found that her right cerebellum needed to be stimulated in order to balance her brain and give her more stability. And this is in order to correct for vertigo with this particular patient. I'm having her increase the speed of that to further drive the cerebellum.
Let's go ahead and recheck her saccade. I want you to look here.
Now what I'm having her do is a saccade, and I'm looking to see whether her eyes go short or go far.
The cerebellum's firing a lot better. What we have is probably a little deafferentation of this parietal lobe, which we want to kind of get both of them to be firing a little bit better at this point. Okay, if I adjust your neck?
After my functional assessment, I determine which area of the spine would be most appropriate to make an adjustment, and this is specifically to stimulate for the left parietal weakness. And I'm now adjusting the shoulder appropriately for balancing her brain as well.
Just relax for me.
And I'm adjusting her elbows and her wrists.
Different from one side to the other.
Again, this is all in order to stimulate her brain to balance out from right to left.
You feel okay? Arms up for me, hon?
And here I'm performing the endonasal release.
Deep breath in.
This is a critical component to long-term correction of these balance and vertigo patients.
A little different there, huh?
We tend to get pretty instant relief for the migraine.
Shifting around?
Yeah.
Yeah? What'd it feel like?
Feel like it's moving back.
Yeah? Did it feel like it was creating some space in there?
Mm-hmm.
Good. Did it feel good?
No.
No? Did it hurt?
No, it didn't.
No? Just kind of a strange feeling?
Right.
Yeah. Okay.
I was very happy with the treatment. It's helped me a lot with my balance. So,
Maybe just a real quick on your history.
well, I came down with vertigo in July, and I was hospitalized for 5 days. I've been through vestibular therapy and hasn't helped, and I did some inquiry online and found your office, so that's why I'm here, and I believe it's helping me.
Hi,